His Excellency David Pine.
Good morning, everybody. Dr. De Silva, our distinguished chair, thank you so much for taking the time to introduce the very many distinguished members of this panel and in the audience, some of whom we've already honoured today. It really is a great pleasure to be here and an honour to be with people who've contributed so much to the health of Sri Lanka. Thanks to the Asia Wellness Forum and the organising committee for the invitation and for the significant effort that's gone into bringing this event together. An exhibition of this scale, gathering healthcare professionals, researchers, educators, business and policy makers, just shows the ambition and commitment to this event now in its 15th year. Healthcare is one of the few areas that connects all of us. At some point in our lives, we all rely on a health system, whether for routine care, urgent treatment, prevention, or advice. And behind every policy discussion or technical innovation is a very human story, like the story of Michael's recovery and Professor Dean's care that our chair shared with us this morning, or like Dr. 𝐄𝐍𝐂𝐄's work to reduce the risks of people requiring surgical interventions in the first place. Events like Medicare create an opportunity to step back from the daily pressures and look at the bigger picture. They allow us to consider not only medical advancements, but also systems, access, training, prevention, and sustainability. They create space for conversations that might not otherwise happen between disciplines, between institutions, but also across borders. Sri Lanka has a long-standing commitment to public health and education. That foundation has delivered important progress over many decades. And at the same time, healthcare systems everywhere are adapting to new realities, ageing populations, rising non-communicable diseases, rapid technological change, and increasing expectations from patients. Responding to all of these challenges requires new forms of cooperation. No single institution, sector, or country has all the answers. Collaboration, practical and sustained, is essential. New Zealand values our long-standing relationship with Sri Lanka. Our partnership is built on mutual respect and shared interest, and in the health sector, we're seeing constructive engagement between our two countries. And we've got a solid history to base this on. From the early 1950s, when talented young Sri Lankans came to my hometown in Dunedin to train as dental nurses, to the visit of our Deputy Prime Minister, during which he launched a sustainable water and livelihoods program last year, and of course, as you heard, through nutrition and through supporting an active lifestyle through our shared love of health. In all, shared love of sport, I should say. In all these ways, health has always been at the centre of our relationship. There are currently initiatives underway linking New Zealand and Sri Lankan institutions and professionals. These include cooperation in medical education, research connections, nutrition science and food systems. And there are exchanges that support professional development and sharing. Practical initiatives that focus on building capability, strengthening standards, and supporting evidence-based approaches. They're not always highly visible, but they contribute steadily to stronger professional links and improved outcomes. In areas such as nutrition and food safety, both countries recognise the fundamental importance of science, regulation, and public awareness in supporting healthier communities. Preventive healthcare, including promoting balanced diets, plays an increasingly central role in reducing long-term health pressures. More broadly, strong health systems depend on three essential elements: people, knowledge, and trust. Skilled and dedicated health professionals, knowledge through research, training, and data that informs sound decision-making, and trust between patients and providers, between institutions, and between international partners. Trust grows through consistency, it grows through dialogue, and it grows when countries engage not only in moments of need, but as long-term partners. Recently, we've been starting to hear some interesting conversations and have some interesting conversations with Sri Lankans from the healthcare sector about how smaller countries from this region and from our region of Oceania might be able to collaborate to scale up and modernise health services together. There are some good ideas out there that we're hearing, and we're open to exploring them with any of you who want to go on that journey with us. Exhibitions like this, and perhaps a targeted conference in the future on a specific theme, will help to foster that environment. They bring together different parts of the healthcare ecosystem, public and private sector, academia and industry, established professionals and emerging leaders. And we've been communicating what we've been hearing at this end to all those sectors in New Zealand. And I can tell you there's genuine interest. When those groups connect, new ideas emerge, new partnerships form, and practical solutions follow. Over the coming days, there will be demonstrations of innovation, discussions on policy and practice, and opportunities to build new professional relationships. And I encourage all the participants to use this time fully, to exchange ideas openly, to explore collaboration, and to consider how the conversations here can translate into meaningful outcomes. The strength of any exhibition is not only what is displayed, but in what continues afterwards. And the follow-up discussions, the partnerships agreed, and the projects that take shape are what are going to matter. And we're here to participate in all of that, not just at a ceremony today. I would like once again to acknowledge the Asia Wellness Forum and all of those involved in organising this event. Bringing together such a wide cross-section of stakeholders requires vision and a sustained effort. Medicare 2026 comes at a time when global health systems are navigating change and opportunity in equal measure. By encouraging dialogue and strengthening cooperation, this exhibition is making a positive contribution. New Zealand looks forward to continuing our engagement with Sri Lanka in the health sector and in other areas of shared interest in ways that are practical, constructive, and mutually beneficial. It's an honour to be with you this morning. I wish you a productive exhibition, thoughtful discussions, and lasting partnerships.